Good morning. Today we are going to see about developmental type of odontogenic cyst. Today our content includes palatal and gingival cyst of newborn, which includes Epstein pearls, bone nodules, and gingival cyst of newborn or dental lamina cyst, and gingival cyst of adult. Epstein pearls, bone nodules, and gingival cyst of newborn, which is also known as dental lamina cyst, are remarkably similar lesions that have often been confused or used interchangeably over time. They share more similarities than differences, including clinical appearance, histology, and natural history of evolution. However, they differ in their embryological origins. Therefore, palatal cyst refers to the Epstein pearls and bone nodules, whereas gingival cyst refers to dental lamina cyst. Let's see about the embryological differences between these three. Epstein pearls. Epstein pearls are the benign and they are keratin-filled cysts that develop from the epithelial remnants trapped along the midline of hard palate during the embryological fusion of the palatal shelf. Whereas bone nodules, they are the benign and self-limiting cystic lesions of oral cavity of newborns. They originate from the remnants of minor salivary gland epithelium. And dental lamina cyst in the newborns, the dental lamina cyst appears as a benign keratin-filled lesion that arises from the remnants of dental lamina and epithelial structure which is involved in the early tooth development. Let's see about the clinical appearance of each. Epstein pearls, they are generally located in the median palatal raphe of the newborn, which appears as a small white or yellowish papules. And bone nodules, they are generally located along the buccal and lingual aspects of the alveolar ridges away from the midline. And dental lamina cyst, they are generally located on the crest of alveolar ridges, either maxillary or in the mandibular areas, as multiple small white or yellowish papules. Histological features. All these three share the same histological features, which demonstrating a thin epithelial lining, a lumen filled with keratin and communication which is having with the surface. A discharge of cystic keratin at the time of fusion of the cyst wall with the oral epithelium indicates the mechanism behind the disappearance of the cyst in the postnatal life. However, it has been suggested that part of the cystic epithelium may remain inactive even in the adult gingiva. Now let's see about the gingival cyst of adult. Gingival cyst of adult occur along the gingiva of older adult, arise from the dental lamina epithelial rest. It is very rare and approximately 0.5% of all odontogenic cysts, and generally arise in the middle-aged or elderly people, and peak incidence in the 5th to 6th decade of life, and most commonly seen in females. Most common site is in the facial gingiva of mandibular canines and premolar, and maxillary gingival cyst usually found in the facial gingival incisor, canine and premolar region. Pathophysiology behind the gingival cyst of adult includes as they arise from the epithelial rest of dental lamina epithelium, that is cell rest of serous, within the soft tissue. The cause of cystic generation of this epithelium is unknown and is considered the soft tissue counterpart of lateral periodontal cyst. Let's see about the clinical features. On intraoral examination, they appear as a smooth, round, pink colored nodule, approximately 5 mm, and they are generally located, as we seen before, they are generally located on the attached gingiva in relation generally to the left canine and premolar in this case, which is extending superiorly up to the mucogingival junction. The nodule, which is found to be as a non-tender, and it is soft in consistency, and it will be fluctuant and non-compressible. In this case, there is a probing of adjacent teeth yielded a pocket depth of 2 to 3 mm, with all sites exhibiting the bleeding on probing. On this case, the radiographic appearance also, there is no radiographic involvement, which is a common feature for the gingival cyst of adult. We can't able to see any radiographic findings in these cases. So let's discuss about the differential diagnosis. The differential diagnosis include as lateral periodontal cyst, peripheral fibroma, parulus and odontogenic keratocyst. Exclude all these things. Since there is no radiographical findings suggesting of osseous involvement, we have excluded the lateral periodontal cyst. And at the same time, the lesion was soft and cystic in consistency, so that we can also exclude the peripheral fibroma. When the lesion is not associated with the periodontal pocket or pus discharge and probing, we can exclude the parolis. Then, when the lesion is not associated with the pain or localized expansion of bone and radiographically there is no osseous involvement, then we can also exclude the odontogenic keratosis, which gives us the final diagnosis as gingival cyst of adult. The general treatment for the gingival cyst of adult includes the local surgical excision, and they typically do not recur. So this is a case of surgical excision of the gingival cyst of adult. So in this case, after the surgical excision, they can able to see the superficial cupping of alveolar bone, which is clearly not detected on the radiograph. So this is a classical sign of a gingival cyst of adult, where in the radiograph we can't able to see any radiographic resorption or any alterations, whereas after the surgical removal of the gingival cyst of adult, you can able to see the superficial cupping of the alveolar bone. Let's discuss about the histological description. It shows the unicystic structure lined with non-keratinized low cuboidal or stratified squamous epithelium, and cystic lining may be with or without continuous epithelial plaques, that is a focal thickened areas of epithelium which may have clear cells, and surrounding the fibrovascular stroma is relatively uninflamed except the biopsy which is included along with the junction epithelium, and we can also able to see some variable inflammatory areas. So this is the case of after the surgical excision. Since the gingival cyst of adult do not have the characteristics of recurrence, there is no recurrence after the post-surgical view. Thank you.